teacher John. I want to welcome you to this lesson. Previously, before our term ended, we were looking at a topic called the reproductive system. During this topic, we stopped on diseases of the reproductive system. We stopped on diseases of the reproductive system. That's where we ended. And that's where we want to begin from. Now, most of the diseases of the reproductive system are sexually transmitted. Most of the diseases of the reproductive system are sexually transmitted. So we are first, if you look at the diseases of the reproductive system, are categorized according to the cause. We have those ones which are caused by virus. We have those ones which are caused by bacteria. We have those ones which are caused by protozoa. Then we have sexually transmitted diseases caused by fungi. So we are going to look at these causes. We have virus, bacteria, protozoa, and fungi. We're going to begin with STDs caused by virus. STDs in full simply means sexually transmitted diseases. I repeat, STDs in full is sexually transmitted diseases. So we are simply going to look at the sexually transmitted diseases caused by virus. We have around 4 major diseases that are sexually transmitted that are caused by virus. Number 1, we have AIDS. Number 2, we have genital herpes. Number 3, we have genital warts. Then number 4, we have cervical cancer. So, STDs caused by virus, we have AIDS, genital herpes, genital warts, and cervical cancer. These are the diseases that are caused by virus. Then we have STDs caused by bacteria. STDs caused by bacteria. STDs caused by bacteria. STDs caused by bacteria. We have around 3 or 4 sexually transmitted diseases caused by bacteria. Number 1, we have gonorrhea. Number 2, we have syphilis. Number 3, we have cancroid. Then number 4, we have chlamydia. Number 4, we have chlamydia. These are the 4 sexually transmitted diseases caused by bacteria. We have gonorrhea, we have syphilis, we have cancroid, then lastly we have chlamydia. Then we have STDs caused by fungi. STDs caused by fungi, STDs caused by fungi. The sexually transmitted disease caused by fungi is candidiasis. Candidiasis. Candidiasis is a sexually transmitted disease that is caused by fungi. Then lastly, we have STDs caused by protozoa. STDs caused by protozoa. STDs caused by protozoa. This one is called trichomoniasis. 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 So trichomoniasis is a sexually transmitted disease that is caused by protozoa. So we are going to look at these sexually transmitted diseases one by one. Allow me, we begin with gonorrhea. Gonorrhea is going to be our disease number one. Gonorrhea. Gonorrhea is caused by bacteria. I repeat, gonorrhea is caused by bacteria called gonococci or gonococcus. Shall I write and say gonorrhea is caused by bacteria called gonococcus. Or you can also call it gonococci. I repeat, gonorrhea is caused by bacteria called gonococcus. The word gonococcus, there's double C after O, gonococcus. This is singular. Then plural, we shall say gonococci. So in case you are asked the cause of gonorrhea, you can simply say bacteria. But in case they ask you to name the bacteria that causes gonorrhea, then you say gonococcus or gonococci. Then gonorrhea is also caused by Neisseria gonorrhea. Gonorrhea is also caused by Neisseria gonorrhea. So you can choose whether you want to write gonococci or gonococcus or Neisseria gonorrhea. If Neisseria gonorrhea is easier for you, then you go with that. Neisseria gonorrhea. This is the cause of gonorrhea. Next, we look at how gonorrhea spreads. How gonorrhea spreads. We've looked at the cause. The next thing you need to know is how does this gonorrhea spread? How gonorrhea spreads. How gonorrhea spreads. Gonorrhea can be spread in different ways, but the major way through which gonorrhea is spread is through having unprotected sex with an infected person. Gonorrhea is spread through having unprotected sex with an infected person. That's the major way in which gonorrhea is spread. Gonorrhea is spread through having unprotected sex with an infected person. With an infected person. How gonorrhea spreads? We said gonorrhea is spread through having unprotected sex. You underline the word unprotected. Having unprotected sex with an infected person. You also underline an infected person. So this is how gonorrhea is spread, through having unprotected sex with an infected person. So we've looked at how gonorrhea is caused, what causes gonorrhea. We looked at how it spreads. Then you need to also learn about signs of gonorrhea in both men and women. Signs of gonorrhea. What are the signs of gonorrhea? Signs of gonorrhea. Signs of gonorrhea. Signs of gonorrhea. Let's begin with men. Signs of gonorrhea in men. Signs of gonorrhea in men. One, sores in the urethra. Sores in the urethra. Now, sores are wounds. I remember when we were looking at the organs of the reproductive system, we looked at a part called urethra. We looked at a part called urethra. so you know what urethra is. So when I talk of sores in the urethra, I hope you understand what it means. Because we looked at that. Sores in the urethra, and I've said the word sores simply means wounds. So you develop wounds in the urethra. Number 2, one feels pain while urinating or when passing out urine. So when men with gonorrhea, they feel a lot of pain while passing out urine. We shall say pain while urinating. Pain while urinating. That is the major sign of gonorrhea in men. That is a major sign of gonorrhea in men. Then, number 3, pus discharge from the penis. Pus discharge from the penis. Pus discharge from the penis. Be careful with the spelling of the word pus. Pus discharge from the penis. And the reason why you feel pain while urinating, it is simply because you have sores in the urethra. So as urine goes through the urethra, because there are wounds there, you feel pain. So that's why that pain is felt while urinating. Then we shall have pus discharge from the penis. Those are the 3 major signs of gonorrhea in men. Then next look at signs of gonorrhea in women. 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 Now, just like men, you shall also have sores in the urethra. Sores in the urethra. Sores in the urethra. Then pus discharge from the vagina. Pus discharge from the vagina. We can say pus discharge from the genitals. Pus discharge from the genitals. Because genitals are the reproductive organs. Then number 3, pain while urinating. Pain while urinating. And I say the reason why you feel pain while urinating is because you have sores in the urethra. So when urine passes through the urethra, you feel pain because the wounds are there. Pain while urinating. Then number 4, blockage of the fallopian tubes. Blockage of the fallopian tubes. Blockage of the fallopian tubes. These fallopian tubes are also known as oviduct. So they get blocked. What blocks them is the pus. And that's why some women fail to become pregnant when they have gonorrhea. Because this pus blocks the fallopian tubes. We looked at the function of the fallopian tubes and where they are located in the reproductive system. So when somebody has blocked fallopian tubes, it could be that this person has gonorrhea. And that's why you always advise to go for medical checkup, especially if you have failed to have children. You may find that you are failing to conceive or to become pregnant because your fallopian tubes are blocked. So blockage of the fallopian tubes or oviduct is a clear sign of gonorrhea in women. Next, look at effects of gonorrhea. How does gonorrhea affect people? Effects of gonorrhea. Effects of gonorrhea. Shall begin with the newly born babies. Effects of gonorrhea. Effects of gonorrhea to newly born babies. Effects of gonorrhea to newly born babies. So, when babies are born, in case the mother had gonorrhea when she was pregnant, can cause blindness. So it causes blindness to newborn babies. Gonorrhea causes blindness gonorrhea causes blindness in newly born babies. Newly born babies. So, babies that are born by mothers who are infected with gonorrhea, they are born when they are blind because pus goes in their eyes, and in case they are not treated, then they will become blind forever. But in case you give birth from hospitals, doctors will be able to detect that there's pus in the eyes of the baby, and they will treat the child, and the child will start seeing. That's why it's very important for pregnant women to give birth from hospitals. So, if they ask you the effect of gonorrhea in newly born babies, gonorrhea can cause blindness. Newly born babies. Next, look at effects of gonorrhea. Effects of gonorrhea to pregnant women. 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 So, in case a woman is pregnant and she contracts or she gets gonorrhea, one is that she may get what we call ectopic pregnancy. So, untreated gonorrhea causes ectopic pregnancy. Untreated gonorrhea. Because you may get gonorrhea and you get treated. But if you don't get treated, then, and you're pregnant, it may cause ectopic pregnancy. Untreated gonorrhea can cause ectopic pregnancy. Ectopic pregnancy. Now, ectopic pregnancy is one of the disorders of the reproductive system. Ectopic pregnancy is one of the disorders of the female reproductive system, whereby the embryo does not move to the uterus for implantation. So after fertilization has taken place to the fallopian tubes, that embryo remains in the fallopian tubes. It doesn't go to the uterus. And when it remains there, it keeps on growing from the fallopian tubes. Then after that, because the fallopian tubes are small and tiny, you don't have enough space to accommodate the growing embryo. Because as the embryo keeps on growing, it needs more space. That's why they go to the uterus. It goes to the uterus for implantation. But if it remains there and it keeps growing from there, then that type of pregnancy is called ectopic pregnancy. How does it happen? Remember we said pus blocks the fallopian tubes. So sometimes fertilization can take place, but because there is pus in the oviduct, that pus blocks the embryo, or it prevents the embryo from going to the uterus for implantation. That's why we are saying untreated gonorrhea can cause ectopic pregnancy. And I've said ectopic pregnancy, the type of pregnancy that takes place in the oviduct or in the fallopian tubes, where the embryo grows from the oviduct. It doesn't move to the uterus for implantation. As simple as that. Then, number two, untreated gonorrhea can cause untreated gonorrhea. Untreated gonorrhea can cause miscarriages. Can cause miscarriages. Untreated gonorrhea can cause miscarriages. Miscarriage is when a woman is pregnant, the fetus or the embryo is expelled from the uterus, and the pregnant woman loses pregnancy. That's a miscarriage. We have so many causes of miscarriages, and untreated gonorrhea is one of the causes of miscarriages. So There are women who become pregnant, then after some time they lose their pregnancy. The fetus in the uterus is expelled out. That is a miscarriage, and untreated gonorrhea can be a cause of miscarriages. Then untreated gonorrhea can also cause a stillbirth. Stillbirth is giving birth to a child who is dead. Untreated gonorrhea can cause a stillbirth. Untreated gonorrhea can cause a stillbirth. I've said stillbirth means giving birth to a dead child or a dead baby. So some pregnant women, they give birth to dead babies because of untreated gonorrhea. So these are some of the effects of gonorrhea to pregnant women. Then we have effects of gonorrhea to women. Still, gonorrhea can lead to the blockage of the fallopian tubes. And these we are going to note. Gonorrhea can lead to blockage. Gonorrhea can lead to blockage the fallopian tubes. Which may cause barrenness. The word barrenness, double R, double N, double S. Gonorrhea can lead to blockage of the fallopian tubes, which may cause barrenness. Barrenness is a condition whereby a woman cannot bear children. They cannot conceive. That means they are barren. So that condition is called barrenness. Why are they unable to bear children? It's because gonorrhea, pus, has blocked the fallopian tube, and that means fertilization cannot take place. And if fertilization does not take place, it means this woman cannot conceive. So that's about gonorrhea. Next we look at how to control gonorrhea. We've looked at the cause, how gonorrhea is spread, signs of gonorrhea in both men and women, effects of gonorrhea, pregnant women, to women who are not pregnant, and to newly born babies. Then next we look at how to control gonorrhea. How can gonorrhea be controlled? Remember we said gonorrhea is spread through having unprotected sex with an infected person, meaning that you can control gonorrhea by avoiding sex. You can abstain from sex. You can have one faithful sexual partner, because when you have multiple sexual partners, there are high chances that you'll get infected with gonorrhea. So you look at how to control gonorrhea. How to control gonorrhea. So gonorrhea can be controlled in different ways. We said one, abstaining from sex. Abstaining from sex. Don't just say abstaining, but you must abstain from sex. Very important. Because you can abstain from anything. Number 2, having one faithful sexual partner. By having one faithful sexual partners. One faithful sexual partner. By having one faithful sexual partner. Then you should avoid having unprotected sex. That means you should always use condoms while having sex. By using a condom while having sex. Using a condom while having sex. By using a condom while having sex. So these are the 3 ways one can control gonorrhea. If you are a school-going child like you, the best way you can control gonorrhea is by abstaining from sex. Then married people should always have one faithful sexual partner. Then we have those ones who cannot be faithful. Those ones who can use condoms while having sex to protect themselves from gonorrhea. That's all about gonorrhea. Next, look at syphilis. 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 Syphilis is caused by bacteria called Treponema pallidum. Syphilis is caused by bacteria called Treponema pallidum. Syphilis is caused by bacteria called Treponema pallidum. Mind the spelling of the word treponema. If the word Treponema pallidum is very difficult for you to write, and they ask you the cause of syphilis, you can simply say syphilis is caused by bacteria, and you stop there. But there are some examiners who can ask you, name the bacteria that causes syphilis. Then there you must be in a position to learn this word called Treponema pallidum, because it is the bacteria that causes syphilis. How syphilis is spread? How syphilis is spread? How syphilis is spread? How syphilis is spread? Now, just like gonorrhea, syphilis is spread through having unprotected sex with an infected person. Syphilis is, and the word syphilis has single L. Single L. Syphilis is spread through having unprotected sex. Having unprotected sex with an infected person. Syphilis is spread through having unprotected sex with an infected person. Signs of syphilis. Look at signs of syphilis. Signs of syphilis. Signs of syphilis. Now this one we shall not categorize in men and women. One of the clear signs of syphilis is having a painless sore on the genitals. Painless sore on the genitals. I told you the word sore simply means wounds. And this sore is painless. You don't feel any pain. And if you're a man or a boy with syphilis, you'll have something like this. Something like a star will appear on your penis. Then after some days, it disappears. After a few days, it disappears. So this is the sore we are talking about. This sore will have the bacteria that cause syphilis. But after some few days, it disappears. And we say the word genitals means these are the reproductive organs. That's why I'm saying in men, you will say painless sore on the penis. Then in women, you can say painless sore in the vagina. So because examiners can be very specific sometimes, they can ask you to identify one sign of syphilis in women. So don't say, you say painless sore in the vagina because they are women. Then in men, you use the word penis. But the word genitals, that one summarizes all. Then another sign of syphilis, we have sores in the mouth and throat. Sores in the mouth. Sores in the mouth. You have wounds in the mouth and throat. Sores in the mouth and throat. Sores in the mouth and throat. Then we have swollen joints. Swollen joints. The joints swell. Swollen joints. Then loss of hair on the head. Loss of hair on the head. Loss of hair on the head. Then lastly, insanity or madness. Then we have madness. It doesn't mean that every person who is mad has syphilis. But madness is the sign of syphilis. If you stay with the untreated syphilis for a period of 20 years without treatment, then you can run mad. And that one is irreversible. Syphilis is not like gonorrhea, because with gonorrhea, those signs come and they don't disappear. But with syphilis, signs appear and they disappear. they appear and disappear as the disease keeps on increasing in your body. Those signs come and they disappear. So if you stay with those signs, they come and they disappear for a period of 20 years. Then the next thing that will happen to you is you will become insane or you will become mad. As I said, not every mad person has syphilis. The only way you can tell whether you have syphilis is going for medical checkup. When I say loss of hair on the head, it doesn't mean that people don't have hair on their heads, then they have syphilis and swollen joints. Those are just signs. So once you see those signs, you go for medical checkup. Then from there, you'll be able to tell whether you have syphilis or not. Next, we look at effects of syphilis. Effects of syphilis. Effects of syphilis. Syphilis causes madness. Syphilis causes madness. Syphilis causes madness. Syphilis causes madness, especially in adults. Because I said when you stay with untreated syphilis for a very long period of time, a period of like 20 years, you become mad. So it causes madness or insanity. So they may ask you effects of syphilis. You will give madness. Then how can syphilis be controlled? How to control syphilis? 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 One is by abstaining from sex. Abstaining from sex. By abstaining from sex. Number two is having one faithful sexual partner. Having one faithful sexual partner. Having one faithful sexual partner. The word sexual here is very important. Don't just say by having one faithful partner, because we also have business partners. Having one faithful sexual partner. Then number three is by using condoms while having sex. By using a condom while having sex. And this condom must be used correctly while having sex. But as I said earlier, school-going children should always abstain, because they can ask you, how can a primary 6 child control syphilis? Don't run to having one faithful sexual partner, because you're not supposed to have sexual partners. The only answer which you can give if they ask, how can a P6 child control syphilis? The only answer is abstaining from sex. Then other people, adults, can either abstain, can have one faithful sexual partner, can use condoms while having sex. But to school-going children like you should abstain from sex. The next disease we want to look at is HIV/AIDS. We want to look at AIDS as our next disease, AIDS. Now, AIDS is a sexually transmitted disease that is caused by HIV. AIDS is a sexually transmitted disease caused by HIV, and you need to know AIDS in full. You need to know how to write AIDS in, because these are abbreviations. That's why we have capitalized the word AIDS. So whenever you write the word AIDS, you must capitalize it, because these are abbreviations. So AIDS in full I'll say write AIDS in full. AIDS in full is acquired immune deficiency, acquired immune deficiency syndrome. Acquired immune deficiency. Yes, acquired immune deficiency syndrome. Acquired immune deficiency syndrome. That is how we write AIDS in full form. Acquired immune deficiency syndrome. Acquired immune deficiency syndrome. Acquired immune deficiency syndrome. Then next, look at what causes AIDS. What causes AIDS? What causes AIDS? What causes AIDS? In other words, what causes acquired immune deficiency syndrome? What causes AIDS? And we shall say AIDS is caused by HIV. 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 Then what is, all right, HIV in full? Need to know. Write HIV in full. HIV in full is human immunodeficiency virus. Human immunodeficiency. immunodeficiency virus. Human immunodeficiency virus. The word immunodeficiency, you have to make sure that immunodeficiency is one word. It's not like AIDS. With AIDS, we have acquired. Immune is different from deficiency. But when you're writing HIV in full, you must write immunodeficiency as one word. Human immunodeficiency virus. So in other words, if they ask you to write the cause of AIDS, you can say human immunodeficiency virus, or you can simply say HIV. As simple as that. How AIDS spread. How AIDS spread. How AIDS spread. When you're writing the word AIDS, you must capitalize the word AIDS. The moment you write AIDS in small letters, then it loses the meaning because you will be writing the word help. To aid is to help somebody or something. That's why we are capitalizing the word AIDS. It's an abbreviation. AIDS is spread in around 3 or 4 ways. One, can be spread through having unprotected sex, just like gonorrhea. Having unprotected sex with an infected person. With an infected person. Through having unprotected sex with an infected person. Number 2, AIDS can be spread through sharing, sharp skin piercing, through sharing sharp skin piercing objects, through sharing sharp skin piercing objects. So if you share a sharp skin piercing object with an infected person, like razor blades, needles, surgical blades, even syringes. If you go to the hospital and they inject you with they use a syringe to inject you, and they also use that syringe on another person, there are high chances that HIV or AIDS can be spread. Then through breastfeeding, AIDS can be spread through breastfeeding. Through breastfeeding. Through breastfeeding. Through breastfeeding. Now, with breastfeeding doesn't mean that the HIV is in breast milk. No. But as these babies breastfeed, they keep on biting the nipples of their mother. So as they bite, blood comes out. And that's how they get infected with the HIV. But it doesn't mean that the virus is in the breast milk. No. The virus is not in breast milk. But if a breastfeeding mother has HIV and the child breastfeeds, this child will keep on biting the nipples and the blood will be coming out because those wounds will be there, which will bring out blood. So that child will get infected with HIV. Then HIV or AIDS can be spread when they are cutting the umbilical cord during birth or at birth, during delivery. When cutting the umbilical cord, when cutting the umbilical cord during delivery or at birth. So HIV can be spread through having unprotected sex with an infected person, through sharing sharp skin piercing objects, through breastfeeding, and through cutting or when cutting the umbilical cord at birth. So when these babies are born, the umbilical cord is cut. In case the mother is infected, that's the time the baby gets infected if the doctors are not very careful. And that's the reason why pregnant women they should give birth from the hospitals, not at home. Because when they give birth from home, away from health workers, some of those guys are a bit careless and the child may get infected in case the mother is HIV positive. So we next look at cultural practices that lead to easy spread of AIDS. Cultural practices that may lead to easy spread of AIDS. Cultural practices that may lead to easy spread AIDS. Cultural practices that may lead to easy spread of AIDS. So there are some traditional practices that we normally do that may lead to easy spread of AIDS. One is traditional circumcision or cultural circumcision. Cultural circumcision. Cultural circumcision. Number two, we have skin tattooing. Skin tattooing. The word tattooing is double T, double O. Be careful there. The word tattooing, you capitalize the T and also capitalize the O. Skin tattooing. Then we have wife inheritance. Number 3. Wife inheritance. It's also a cultural practice. Somebody dies somewhere and the people inherit those wives without knowing what killed their husband. They end up getting infected with HIV. Number 3 is wife inheritance. Wife inheritance is a cultural practice that may lead to easy spread of AIDS. Number 4, we have extraction of false teeth. Extraction of false teeth. Then we have ear piercing. Ear piercing. For example, if you go to the Maasai community, they pierce the ears culturally, and they keep on using the same objects. That one can lead to easy spread of HIV or AIDS. Then cultural circumcision. With cultural circumcision, these traditional surgeons, they call themselves surgeons, they use same knives, different people using the same knives to circumcise them. So in case one of them has, then others will also get infected. Then we say false extraction of false teeth. Next we look at signs of AIDS. Signs of AIDS. Signs of AIDS. And you find that the signs of AIDS, signs of AIDS may be similar to some other diseases. But that one doesn't mean that. So there are some diseases with similar signs with AIDS. For example, one of the signs of AIDS is loss of body weight. Loss of body weight. Loss of body weight. Loss of body weight. Number 2, oral thrush. Oral thrush. Oral thrush is having sores in the mouth. As it's called oral. Oral thrush. Then we have chronic cough. Chronic cough. We have chronic diarrhea. Chronic diarrhea. Chronic diarrhea. Then we have another one called herpes zoster. Herpes zoster, something like a belt which appears either in the neck or in the waist. In Uganda, it's called chisipi. It's called herpes zoster. It's a clear sign of AIDS. Even skin cancer. Skin cancer. Then we say herpes zoster. Herpes zoster. Herpes zoster is, in Uganda, it's called chisipi. It's something like a belt which appears around your neck or around the waist of an infected person. So these are clear signs of AIDS. In our next lesson, we shall look at how effects of AIDS, how to control AIDS, how has AIDS affected the community, the family, individuals, and so on. Thank you.